Hello everyone, and welcome to your virtual learning experience over fall prevention. My name is Lieutenant Commander Kayla DeWitt, and I am the Director of Physical Therapy here at the Oklahoma City Indian Clinic. Elizabeth Yates is a physical therapist assistant here at the clinic and will also be educating you on fall prevention today. A little background information on us. Together, we have over 25 years of experience and have worked side by side for 4 years. We are both certified fall prevention specialists, and we are excited to share this information with you today. So here are the objectives for today's lesson. You will be able to identify who is at risk for falling, describe negative outcomes of a fall, and name multiple strategies for reducing your risk for falling. So the first thing we want to do is to check your risk for falling. We are going to do that by completing a couple of things. First, on a scale of 1 to 10, with 1 being very confident and 10 being not confident at all, how confident are you that you can do the following activities without falling? Taking a bath or shower, reaching into cabinets or closets, walking around the house, preparing meals not requiring carrying heavy or hot objects, getting in and out of bed, answering the door or telephone, getting in and out of a chair, getting dressed and undressed, personal grooming such as washing your face, and getting on and off the toilet. Once you have rated each of these activities, add up your score. If you have a score that is greater than 70, that indicates you have a fear of falling. The next test is a 30-second chair stand. The purpose of this activity is to test leg strength and endurance. To begin, sit in the middle of the chair. Place your hands on the opposite shoulder crossed at the wrist. Keep your feet flat on the floor. Keep your back straight and keep your arms against your chest. On go, rise to a full standing position, then sit back down again. Count how many times you come to a full standing position in 30 seconds. On the next slide, Elizabeth will perform the test. Do it along with her and count how many times you stand in 30 seconds. Now take the number of times you completed the sit to stand and compare to the following chart. If your score is below average, you are at risk for falling.
Why is fall prevention important? Fall prevention is important because falls can impact one's life and well-being. Some staggering facts about falls are 1 out of 3 older adults fall each year. People who fall once are 2 to 3 times more likely to fall again. Falls are the leading cause of non-fatal injuries among older adults. Many people need to spend at least a year recovering in a long-term care facility, and some are never able to live independently again. Injuries and death from falls are common. In fact, every day, roughly 74 older adults die from a fall, and every 13 seconds, an older adult is treated for a fall. The resulting injuries are expensive, with direct medical costs from falls totaling $44 billion. Falls impact caregivers too. Research has shown that after a care recipient's first fall, caregivers report a significant increase in caregiver burden, fear of falling, and depression. Falls increase with age. 27% of people between the age of 65 and 74 reported a fall. 30% of people between the age of 75 and 84 reported a fall. And 37% of people over age 85 have reported a fall. Falls can cause broken bones like a wrist, arm, ankle, or hip. They can also cause an injury to your head, which can be very serious. Many people who fall, even if they're not injured, become afraid of falling. This fear may cause a person to cut down on their everyday activities. When a person is less active, they become weaker, and this increases their chances of falling. 1 in 4 of each person who is currently 65 will live to be 90 years old. So you could have a lot of time left to live, and you have the power now to make the rest of your life enjoyable by staying active, healthy, and independent. Falls can cause pain, embarrassment, fear, loss of function, serious injury, or even death. I know these facts can all be very scary, but falls are preventable. and today we are going to talk about some things you can do to decrease your fall risk. Before we talk about things you can do to decrease fall risk, let's take a look at our balance systems and how balance problems can occur. Balance problems make it difficult for people to maintain stable and upright positions when standing, walking, or even sitting. One of these systems is vision. Poor vision can result from age, eye tracking problems, or eye diseases. The next system is the inner ear. Inner ear problems, also called vestibular problems, can develop from trauma, aging, poor nutrition, or disease. Another system is the muscular system. Muscle strength and flexibility can decline due to lack of exercise, sedentary lifestyle, or disease. And finally, proprioception, which is the awareness of one's own body position. Body position sense can become abnormal as a result of trauma or a disease such as diabetes. The brain coordinates impulses from the eye, inner ear, and body position senses and sends signals to the muscular system to move or make adjustments to maintain balance. If one or more of these systems is not sending correct signals to the brain, or if the muscular system cannot carry out the necessary movements, a person may not be able to maintain or correct their balance. Here are some risk factors for falling. The more risk factors present, the chance for falls increases. Home or environmental hazards that can increase risk are things such as broken or uneven steps and throw rugs or clutter that can be tripped over. Home or environmental risk factors play a role in about half of all falls. Confusion can sometimes lead to falls. For example, if you wake up in an unfamiliar environment, you might feel unsure of where you are. If you feel confused, wait for your mind to clear or until someone comes to help you before trying to get up and walk around. Diabetes, heart disease, or problems with your thyroid, nerves, feet, or blood vessels can affect your balance. Some medicines can cause you to feel dizzy or sleepy, making you more likely to fall. Even some over-the-counter medications can affect balance and how steady you are on your feet. Some medications can increase a person's risk of falling because they cause side effects like dizziness or confusion. The more medications you take, the more likely you are to fall. Foot problems that cause pain and unsafe footwear like backless shoes or high heels can also increase risk of falling. The more risk factors a person has, the greater their chances of falling. What might occur or how might you feel when you have a balance problem? If you noticed you often trip, sway, stumble, feel dizzy, have vertigo like the room is spinning, or of course actually fall, you likely have a balance problem. Balance problems can make a person fearful of performing simple daily activities. As a result, they may lose muscle strength and become frail because they avoid strenuous or challenging movements. A person who has balance problems may start to feel frustration about the condition and become depressed. It's true that falling is very common, but you don't have to fall. There are specific things you can do to reduce your chances of falling. Some of these can be done once, some daily. Talk openly with your healthcare provider about fall risks and prevention. Tell your provider right away if you fall, worry about falling, or feel unsteady. Review all your medications with your doctor. Make sure they review even the over-the-counter medications or supplements that you take. As you get older, the way medicines work in your body can change. Some medicines or combinations of medicines can make you sleepy or dizzy and can cause you to fall. Talk with your doctor about taking vitamin D supplements to improve bone, muscle, and nerve health. Always tell your doctor if you have fallen since your last checkup, even if you weren't hurt when you fell. A fall can alert your doctor to a new medical problem or problems with your medications or eyesight that can be corrected. Your doctor may suggest physical therapy, a walking aid, or other steps to help prevent future falls. Ask your doctor if there are any exercises or activities you should avoid. Your doctor can make recommendations based on your health history, keeping in mind any recent surgeries or ongoing health conditions such as arthritis, diabetes, or heart disease. This would be a great time to check with your doctor about any unexplained symptoms you've been experiencing, such as chest pain or pressure, joint pain, dizziness, or shortness of breath. Your doctor may recommend postponing exercises until the problem is diagnosed and treated. Ask your doctor if your preventative care is up to date. Your doctor can tell you if there are any tests you might need. For example, women over age 65 should be checked regularly for osteoporosis. Ask your doctor how any health conditions might affect your ability to exercise. Some health conditions can affect your exercise routine. For example, people with arthritis may need to avoid some types of activity, especially when joints are swollen or inflamed. Those with diabetes may need to adjust their daily schedule, meal plan, or medications when planning their activities. Your doctor can talk to you about any adjustments you need to make to ensure that you get the most of your new exercise routine. If you are a caregiver, I encourage you to take these same steps in fall prevention for your loved ones. Preventing falls saves time, money, and stress that can be increased from injuries caused by falling. As a caregiver, it would also benefit you to take part in an exercise program to improve your own physical and mental well-being. Being stronger helps minimize the physical strain on your body if you have to lift or transfer your loved one or their medical equipment like a walker or wheelchair in and out of the car. It would also be beneficial to take some training on efficient and safe lifting techniques. Family Caregiver Alliance is one helpful online resource if you are a caregiver. Check out www.caregiver.org for tips, education, and other resources regarding caring for your loved one.
As a caregiver, you may need to speak up for your loved one. The more you know, the more you can help your loved one. Be considerate of the language you use. For example, "I'm worried about you and want to help" is beneficial and supportive. Be mindful of how you describe the changes you have noticed that may increase their risk of falling. Had they been holding onto walls, furniture when walking? Do they have difficulty getting up from a chair or tripping over their feet? Always be mindful of your tone and body language and be positive. Be clear you want to talk about their overall safety. Suggest attending your loved one's doctor's appointment to help cover all bases of fall prevention and pair it with something fun, such as going out to lunch or another enjoyable activity for the individual. This is a conversation that will likely happen more than once, so be open to changing your strategy if that's what's best for your loved one. Now we are going to discuss a few strategies to help decrease your risk of falling and reduce your fear of falling. One thing you can do is to assess problem footwear and hazards in your home that increase your risk of balance problems or falling. Household hazards include loose rugs, poor lighting, unrestrained pets, or other possible obstacles. If you can regain confidence in your balance and your ability to move freely and perform daily activities, you will be better able to enjoy your normal daily activities and remain independent. A physical therapist can help with this. Regaining the ability to move around with more ease, coordination, and confidence will improve your mobility, therefore improve your balance. It's important to practice both static balance, which is sitting or standing still, and dynamic balance, which is keeping your balance while moving. It's important to perform exercises to address muscle weakness or to improve your overall muscle strength. Strengthening muscles in the trunk, hip, and stomach can be especially helpful in improving balance. Various forms of weight training can be performed with exercise bands, which help avoid joint stress. Another way to help improve balance is to restore normal movement in any of your joints that are stiff. These might begin with passive motions that the physical therapist performs for you and progress to active exercises that you do yourself. To improve flexibility and posture, you can gently stretch your tight muscles and perform exercises to improve your ability to maintain proper posture. Having good posture can improve your balance and reduce your fall risk. If you work on improving what we have talked about so far, balance, flexibility, posture, and mobility, you will be able to gradually increase your activity levels, allowing you to be more independent on a daily basis and get back to doing the things you want to do. Now we are going to discuss a few ways to prevent falls. One way is to avoid a sedentary lifestyle by staying active. Mild weight-bearing activities, such as walking or climbing stairs, may slow bone loss from osteoporosis. It's good to perform a challenging physical activity each day to keep your muscles strong and flexible, and your heart and lungs strong. Use your body as much as you can safely to walk, climb stairs, garden, wash dishes by hand, and other daily activities that keep you moving. Exercise is effective in reducing falls in the spectrum of people who range from relatively fit and well in community dwelling to cognitively intact people living in residential care facilities. Older adults should do at least 150 minutes of moderate intensity aerobic physical activity throughout the week, or do at least 75 minutes of vigorous intensity aerobic physical activity throughout the week, or an equivalent combination of moderate and vigorous intensity activity. Aerobic exercise should be performed in bouts of at least 10 minutes duration. For additional health benefits, older adults should increase their moderate intensity aerobic physical activity to 300 minutes per week or engage in 150 minutes of vigorous intensity aerobic physical activity per week, or an equivalent combination of moderate and vigorous intensity activity. Older adults with poor mobility should perform physical activity to enhance balance and prevent falls on 3 or more days per week. Muscle strengthening activities involving major muscle groups should be done on 2 or more days a week. When older adults cannot do the recommended amounts of physical activity due to health conditions, they should be as physically active as their abilities and conditions allow. If you are unsure if you can or should do an activity, play it safe today. Ask your doctor tomorrow. A few safety tips. Walk during the day or in well-lit areas at night, and be aware of your surroundings. To prevent injuries, be sure to use safety equipment. Dress in layers when exercising outdoors so you can add or remove clothes if you get cold or hot. Be sure to drink plenty of liquids when doing any activity that makes you sweat, and do a little light activity to warm up and cool down before and after your endurance activities. When it comes to falling, you are more likely to fall if you are sleepy, so it's very important to stay rested and get a good night's sleep. Alcohol can affect your balance and reflexes, even if it's just a small amount, so limiting your alcohol intake can help prevent falls. Don't be in a rush. Your blood pressure can drop if you get up too fast, and this can make you feel off balance and possibly fall. Small changes in sight and hearing may cause you to fall, so it's a good idea to get your eyes and hearing checked yearly because this can make a big difference when trying to prevent falls. Good eyesight is about more than 20/20 vision. For example, you need to see well in the dark to drive safely at night or walk to the bathroom in the middle of the night. Untreated hearing loss can also increase your risk of falling. Researchers found that people with mild hearing loss were nearly 3 times more likely to have a history of falling. Having your healthcare provider check your feet is also an important yearly exam. Falls are more likely when wearing inappropriate footwear, such as flip-flops that don't cover the heel. Wearing safe shoes that fit well, have a firm heel to provide stability, and have a textured sole to prevent slipping will decrease your risk of falling. Slick surfaces can cause anyone to fall. Try to have sand or salt spread on icy areas by your front or back door as needed. As mentioned on the previous slide, wearing appropriate shoes can decrease your risk of falling. Wear non-skid, rubber-soled, low-heeled shoes or lace-up shoes with non-skid soles that fully support your feet. It's important that the soles are not too thin or too thick. Try to avoid walking on stairs or floors in socks or in shoes and slippers with smooth soles, as this may cause you to fall. Appropriate use of canes and walkers can prevent falls and are necessary for some people. Make sure it is the right size for you, and if using a walker, the wheels roll smoothly.
Assistive devices may be used to help promote increased safety, but it is important to select the proper type, proper fit, and proper technique. Canes and walkers are the most common types of assistive devices used for balance. A single tip cane is the least supportive because it makes only one point of contact on the ground. There are different types of handles you can choose per your preference. You can also get them in fun colors. They also have collapsible ones that can fit in a bag or purse, but make sure those are fully locked out before use. A quad cane is more supportive because instead of one point of contact, the quad cane has 4. Though one is more supportive than the other, you use them the same way. First, talking about fit, you can have a family member help you or look in a mirror. Standing tall with arms relaxed by your sides, the handle of your cane should align with your wrist crease. Most canes are adjustable with a push pin to adjust to different heights. Secondly, for proper use during gait. If you have an injured or weaker leg, you would use the cane in the opposite hand, but for balance purposes, you may choose whichever side you feel the most comfortable and secure. Advance the cane in the opposite leg at the same time, then step through with the other leg. When ambulating stairs or steps, use handrails for extra safety whenever possible. Indicated in red will be the weaker leg. When going up, you step with the foot closest to the cane first, which should be the stronger leg, followed by the cane and the opposite foot or the weaker leg. When going down, the cane goes first, followed by your weaker leg, then the stronger leg. More supportive than canes are walkers because they offer 4 points of contact more spread out on the ground. There are also different types of walkers and they offer different types of support and convenience. A standard walker is going to be the most supportive but less convenient and less mobile. A two-wheeled walker would be more convenient in mobility but less supportive to balance. Finally, the rollator with the seat is the most convenient in terms of mobility due to rotational wheels for greater ease in turning, maneuvering, and ambulating across varied surfaces. However, due to the increased mobility, it does make it less supportive to balance. There are also other safety measures to consider when using a rollator, such as braking when appropriate, such as when sitting down. Fitting a walker is the same as a cane. Stand tall with arms relaxed with your walker in front of you. The handles should be at your wrist crease. Use the push pins on the legs to adjust to the appropriate height. Stand tall with your feet near the back legs of the walker. If walking with a standard walker without wheels, you progress the walker forward, followed by step, step, etc. If walking with a rolling walker, you continuously progress the walker forward while you walk right, left, etc. Be sure to maintain good posture to avoid stooping forward, but keep from getting too close inside the walker because this can also throw off your balance. Be aware of obstacles such as electrical cords, rugs, uneven surfaces, etc. whenever walking with an assistive device. Additional safety measures to consider when using a walker is during ambulation of steps or curbs. The walker is easier to remember because the walker goes first whether you are going up or down. While going up, if applicable, your stronger leg would follow the walker. While going down, if applicable, your weaker leg would follow the walker. Otherwise, whichever leg feels more comfortable is the one you would step with first. A common mistake made when transferring with a walker is grabbing onto the walker at the wrong time. This can increase chance for falls. While sitting on a firm, safe surface, you would back up to the seat until the backs of your knees are touching or are close to touching the seat. Next, you reach back for the seat with one hand at a time, then slowly lower yourself down. While standing, place the walker in front of you, but avoid grabbing the walker to try and lift yourself. This will cause the walker to tip and you to fall backwards. Instead, use your hands on the armrest or seat to help press up to stand. Once you are mostly upright and steady on your feet, you will grab the walker one hand at a time. Stand for a few moments to make sure you have your bearings before beginning to walk. Now that we have covered the common assistive devices used for balance, you may now wonder, should I or my loved one use one? And which one should I or they use? If you or your loved one has had several falls due to loss of balance, it may now be a good idea to start using an assistive device. While performing balance activities that we will cover in a moment, it takes time to build those muscles, so the person may need extra assistance now. Once muscles and balance systems are stronger, it is possible that the assistive device can be discontinued, or if using one already, be able to progress to a less supportive, more convenient option. Reviewing the assistive devices in least to most supportive, a single tip cane would be the first line of defense in choosing a device. If that option doesn't work, then a quad cane or walker could be used for more support. Here are some fall prevention tips to be aware of in your home or community. Install sturdy rails along any stairs or steps. Avoid using throw rugs in living areas. Make sure bathroom rugs have a non-skid backing to keep it from sliding. Install non-skid strips in your tub or shower. Arrange furniture so that chairs, tables, footstools, or other items are not in the path where you will be walking. And ensure electrical cords are not in your walkway to avoid tripping. Use a bath seat when taking a shower. Install grab bars in your shower or tub and beside the toilet. If you need help when you sit and stand, use the arms of the chair to support your body weight. Choose sturdy furniture that is not easily turned over. Steps, entryways, and ramps should be well marked and easy for you to see. Get your eyesight checked at least once a year to address any vision problems. Make sure all areas of your home are well lit. Use a lamp or other nightlight when getting up in the middle of the night to use the restroom. Upon rising from a lying position, sit for a few moments to allow your body to adjust before standing up to help prevent any dizziness that could lead to falls. Pay attention to where you are. Look for uneven surfaces, wet floors, clutter, or other obstacles that may put you at risk. Ask your doctor or physical therapist about an exercise plan that can help to improve strength and balance. So what if you still fall? What will you do? You want to try and stay calm, taking deep breaths. Relax and remain still on the ground for a few moments to decide if you were hurt before trying to get up. If you feel safe, roll on your side and rest. Get on your hands and knees, crawl to a sturdy chair, and get into a kneeling position to rise. Call 911 or use an emergency response system if needed. If you are alone when you fall, do your best to get to a phone to call for help. If you are unable to get up and have another person present, have them call 911.
Now it's time to go through a few exercises that you can do at home to help improve your balance. You will need a sturdy chair to perform the exercises. For the seated march, start by sitting in a chair. Lift up your foot and knee, set it down, and then perform on the other leg. Repeat this alternating movement. Start with 10 reps and work your way up to 3 sets. For the lateral trunk lean, scoot forward in your chair or wheelchair so that you are sitting up tall. Lean to the right as far as you can without losing your balance. Repeat this leaning to the left. Keep yourself sitting tall through the whole range of motion. Start with 10 reps and work your way up to 3 sets. To perform the forward rock, scoot forward in your chair or wheelchair. Lean forward as far as you can without losing balance and then return to sitting tall. You can perform this in front of a kitchen table to increase safety. Start with 10 reps and work your way up to 3 sets. Next, try the Romberg stance. Stand tall next to a table or other sturdy object. With your feet together and arms crossed over your chest, try and hold and balance in this position the best you can. If you lose your balance, you can use one or more strategies to help. Take a step, unfold your arms and raise them to the sides, or grab onto a sturdy object for support if needed. See if you can hold the stance for 10 seconds and repeat 3 times. Gradually add time as your balance improves. Now try the tandem stance. This is when one foot is directly in front of the other foot, with one heel touching the toes of the other foot. Once you have the foot placement, hold this position for 10 seconds. Repeat with the opposite foot in front. Gradually add time as your balance improves. For the single leg stance, stand on one leg and maintain your balance. See if you can hold this stance for 10 seconds and repeat 3 times on each leg. Gradually add time as your balance improves. To make this more difficult, close your eyes or stand on something unsteady such as a pillow. Now do the sit to stand. Variables of this exercise include height of surface, spacing of feet, speed, and with or without upper extremity assist. You can further challenge yourself by adding resistance with a circular band around distal thighs or holding weights. You will want to remember these cues during the exercise. Nose over toes, push into ground with your feet, keep abdominals engaged and back flat, slowly return to sitting and repeat. Start with 10 reps and work your way up to 3 sets. The next exercise is the standing march. While standing, lift your foot and knee up, set it down, and then repeat on the opposite side. Use your arms for support if needed for balance and safety. Start with 10 reps and work your way up to 3 sets. The last activity is the mini lateral lunge. Step to the side and balance on the leg. Next, return to the original position. Your knees should be bent about 30 degrees while performing. Stand in front of a sturdy object for balance if needed. Start with 10 reps and work your way up to 3 sets. To wrap up, let's review the objectives. You should now be able to identify who is at risk for falling, describe possible negative outcomes of a fall, and name multiple strategies for reducing your risk for falling. We appreciate you taking time out of your day to learn about fall prevention. We hope you found this presentation educational and informative. If you have any questions or concerns, please contact your Oklahoma City Indian Clinic healthcare provider or physical therapist.